So as an OT in mental health, it is very important for us to design or to plan our treatment. But for me, it's more like it's not like a treatment. A treatment is like you, for example, you using wax baths, you using infrared. They call a treatment. But for us, it's more like planning intervention for them. Planning intervention for them. So when we plan, it can be education, it can be consultation, can be training, um, advocate them. So it's more on intervention planning. So when we want to plan, sure we have to understand what are their problem and what are their issue. So this is the topic that we are going to highlight. And then when talk about goal setting, how we going to come up with our goal setting and activity analysis, which is very important for OT in mental health. So when we want to plan, you for this semester you also been teach by Dr. Zamir kan? Yeah. Anyone?
Yes.
Dr. Zamir Some of you ada exemption OT assessment in psychiatry. Yeah.
Yes, sir.
Yes, sir.
Some of you have exemption. Some of you have to take this OT assessment in psychiatry. So when you plan, when you're going to plan your intervention, your intervention, first thing you have to collaborate between patient and therapist. You have to collaborate with your client. So we call it client-centeredness. So it's very important at the end. What we want to achieve is what therapists want. So we need to collaborate. Some of the collaboration more than that. Some we have to collaborate with the spouse, with the family. So we need collaboration with those people yang involved dengan client, dengan patient. So another thing, emphasize on priorities. So that's why we sometimes when we want to plan, we want to understand their priority. And so when we interview them, when we assess them, so there is a priority, there is a needs, what they want, but we focus on the priority first. So this is very important. Emphasize on priorities. And then you have to understand your patients in terms of their condition, their symptom. So patient, whether their symptom of psychiatric have reduced or still there. And so you also need to understand what medication being taken by the patient. This will affect your plan of intervention. Then you need to understand also patient environment. Patient environment, whether they have support from their family, whether the employer still accept them, whether their friends or their peers or their relative understand patient punya condition. It is very important. Some of the patient, the family have abandoned them. Abandon them, it means like dia dah tak kisah dah dengan patient ni, apa jadi kat patient ni, dia orang dah tak kisah dah. So we need to understand. support getting from the patient. And then you have to understand or increase your awareness of patient volition. It mean what? Volition mean dia punya motivation, whether they are ready to start with your intervention. Some of the patient, they are not motivated. They're not ready to go to the long-term punya planning. Because of their condition, for example, they still have psychiatric symptom. For example, like schizophrenia, they still have positive symptom, and then they also have negative symptom. For example, avolition. There's no motivation, no insight. So you need to understand your patient. You cannot go to the long-term punya planning. For example, you want them to work at a competitive employment or that. So you cannot. So you have to have a short-term planning for them at the beginning. This is very important. Other than that, anyone? When you want to plan your patient treatment, intervention, what you should consider? Anyone? Iswani? Mana Iswani?
Yes, sir. Yes, sir.
So anything that we need to consider when you want to plan your treatment intervention?
Client lah. Should be client-centered.
Yeah, I already mentioned that. Other than that, whether your client, your patient is an acute case or chronic case. So some of your patient is acute, they still, they're still having a defense mechanism. They still have inferiority complex. Kan? You kalau dapat sakit mental, sure, you ada inferiority complex, kan? You rasa rendah diri dan sebagainya. So, for example, like chronic case, dia dah biasa. Chronic case is patient yang keluar masuk hospital. Keluar masuk hospital. So this patient already understand and also some of them take for granted and take, for example, they are very manipulative client. So you need to take into consideration because they already been there quite many times, kan? So you need to also understand whether your client is a acute case or chronic case. Lagi apa yang kita kena consider? Yang dah pernah pergi posting ni. Siapa? Ras? Mana Ras? Before we plan, apa lagi yang kita kena consider, Ras?
Kena tengok family support dia juga.
Support saya cerita tadi, environment of the patient, kan? Lagi? Tak dengar tadi ya? Apa lagi? Anyone? Alia? So, all these things need to take into consideration when you going to plan your intervention or your treatment. So I will highlight to you one video. This video I obtained from the YouTube lah. When they interview the patient. Okay.
Hi there, my name is I'm the occupational therapist here at the day centre. How are you today? Hi, Mary. I'm good, thank you. That's good. And then, do you know why you're here today? Are you going to help me live by myself? That's what I've heard. Yeah, exactly. And would you like to
Rasa tak nampak video dia.
friends your own age?
Tak nampak?
Video tak
Tak.
keluar.
Nampak tak?
Tak.
Tak nampak kan? Okey, sekejap.
And they just try to tell me what to do all the time. I'm 19 and they just treat me like a baby. Yes, I completely understand. That must be very annoying. Yeah. And what is it you'd like to be able to do by yourself?
Okey, tengok video ni.
Hi Ben, my name is Mary and I'm the occupational therapist here at the day centre. How are you today? Hi Mary, I'm good, thank you. That's good. And Ben, do you know why you're here today? Are you going to help me live by myself? That's what I've heard. Yeah, exactly. And would you like to live by yourself in a home without your mum and dad, with friends your own age maybe? I would love that. My mum and dad are being so annoying. I can't do anything without them there, and they just try to tell me what to do all the time. I'm 19 and they just treat me like a baby. Yes, I completely understand. That must be very annoying. Yeah. And what is it you'd like to be able to do by yourself? I just want to be able to other people my own age. I want to be able to friends at work and get the best to work. My dad is so embarrassing. He drives me there every day. So embarrassing. And what I really want to do is be able to make my own lunch for work. Just because my mum gives me healthy food and stuff I don't really like, so I would love to be able to do that on my own. Yes, I definitely understand. We can definitely work towards that. And have you got any other hobbies or interests that you like? I love watching telly, and I like football as well. I also like to go to the pub with my friends, but my mum and dad will let me go on my own. My dad comes with me. That's why I didn't want to live my own, just because I just wanted to be able to do my own thing. Yeah. It would be great to be able to do whatever you want and have got all that freedom. Yeah. And do you think you'd be able to manage by yourself? Would you be able to wash yourself and cook for yourself? Yeah, I wash myself. And I can dress myself sometimes, but I can't do bits and stuff. I don't know why. I try, I just struggle with it. Oh, not to worry. My mum does cook for me though, but I'd love to learn to cook for myself. Oh yeah. Well, okay, that sounds great. I'm just going to do a quick assessment with you and ask you a few questions, just to get a better understanding of what you'd like to get out of this session. Is that okay with you, Ben? Yeah, that's fine. Thank you, Mary. Great.
Okay. So video tadi, when you see the video tadi kan, dia lebih kepada therapist want to understand what the client needs. So this therapy explore what the need and their client punya priorities. You see that very important. We should understand and explore our client priority and needs. Dalam video tu dia nak apa sebenarnya? Anyone? Klien nak apa? Orang pun tak dapat tangkap dia. Dia punya language tu tak boleh dapat tangkap. Anyone?
British accent dia tu kuat sangat.
Sound tak clear?
Uh-uh.
And then dia punya slang tu kan, slang British tu. Probably in future you're going to work at the British punya UK punya tempat kan. This is the way. Kita tengok klien tu macam ada problem apa? Problem dia pun tak ada eye contact. And then therapist tu tanya, you nak buat apa, nak masak ke, you want to cook, all that kan. That's the way kita explore. It's more on client-centeredness. Okay, that is the example of client-centeredness. Some, when we interview, also depend on the client. Sometimes client unable to share their needs and their priorities. Some of them we need to guide them. We need to guide them to make a choose untuk dia pilih. So what are their priorities? So when you got your when you got the feedback from your client, then you have to do data analysis. The data analysis is depend on the environment and also the occupation. It means that a client, you need to understand dia punya role, dia punya occupation, and dia punya role and dia punya routine. Kalau ikut Moho punya konsep, you need to understand dia punya role, dia punya routine, dia punya habit, and then consider another thing, dia punya environment. Tempat dia bekerja, where is she going to work, where is she going to stay, what type of job dia pegang, dia sekarang ni dia buat. So you want your plan must be short term and long term, untuk dia kembali bekerja according dia punya role and also dia punya occupation. Mel, I ada kelas, Mel. And then areas of dysfunction. Areas of dysfunction is what are the things they are unable to function. For example, they are unable to communicate. They have problem of skill of communicate. They are unable to focus, concentrate. They are unable to manage time. They are able to perform their ADL. So areas of dysfunction. So you have to understand. So when you do interview and also assessment, I'm sure Dr. Zamir have done dia punya assessment. So you need to understand what are the areas that they have dysfunction. Probably area of dia punya ADL or IDL. You need to understand that. So you need to detect them. And then you need also need to understand what are the range of skill available right now to the patient. For example, a patient ni, he can communicate, but when communicate to one-to-one person, ataupun dengan orang yang dia tak kenal, dia ada problem, or unable to give a talk to a bigger group or larger group. This is the thing that you need to understand when you got your data, when you want to analyze. Lagi apa lagi yang boleh kita buat analisis? Alia? Mana Alia? Okay, Alia? I don't want to I saja yang bagi cakap kan. You all semua kena bagi input juga. Alia?
Ya.
Apa lagi yang kita nak analyze data yang kita dapat?
Analyze dia punya habit, dia punya routine dengan roles.
Okay, tadi saya dah cakap habit, routine and dia punya roles. Lagi?
Dia punya work schedule dia.
Yeah, good. Work schedule, work habit. Lagi apa? Work habit, work schedule. Dia punya time, kan? Time untuk complete the job, kan? Lagi? For example, the client working at the shopping center. What you going to analyze lagi? Dia kerja sebagai seorang supermarket. Kerja sebagai cashier. Apa lagi yang you nak analyze? Alia?
Ya.
Ya. Apa lagi you nak? Apa dia? Okey, bayangkan patient you dia kerja sebagai cashier dekat supermarket Ion katakan. So apa lagi kita nak analyze? Kita nak analyze dia punya IADL. IADL ni macam mana dia nak pergi daripada rumah dia ke tempat kerja, kan? Kalau dia sakit yang dia dapat sakit skizofrenia, probably dia ada masalah untuk dia ada disorientation katakan, dia dah lupa dah naik bas nombor berapa, bayaran tiket nombor berapa ringgit, kan? So you kena analyze juga itu, cara dia macam mana dia nak mobilize herself untuk pergi kerja. Di tempat kerja also you need to analyze whether di tempat kerja tu to what extent dia punya job description. This the thing you need to analyze, dia punya job task dia tu. Okay. So when setting goals, you need to have, this is the process when you want to set the goals, you have to target what are the thing, after you buat data analysis, what the thing you want to target through OT intervention. For example, you want to improve dia punya skill communication, kan? They are unable to communicate to other person. This is the skill you want to target through OT intervention. So the skill to be learned and acceptable level of performance. So you need to train them. Skill to be learned and acceptable level of performance. So skill, katakan dia unable to communicate to other person. This is the skill. Unable to ventilate dia punya feeling, katakan. Unable to express dia punya feeling and thought. Dia, for example, dia seorang bila dia kena sakit when he suffer mental ill ni, dia seorang yang dia ada masalah untuk express dia punya feeling. Dia skill untuk express dia punya emotion, dia punya anger dah tak ada dah. So you want to set a goal how to express dia punya emotion. So this is the skill to be learned and acceptable level of performance. And then you need to have bila you target tu mesti within patient capabilities. You kalau buat intervention, you tak boleh buat training yang lebih daripada kemampuan pesakit. For example, patient ni dia tak you nak train dia untuk socialize, katakan. Bawa dia main bowling, katakan. Tapi dia tak pernah pergi bowling. Dia tak pernah throw the ball, kan? For bowling, So you need to set intervention within patient capabilities. So when you set your goals, you need to involve patient. And then when you involve patient, when you target the goal, patient absolutely clear, not too vague. dia mesti clear. This is the target you're going to achieve. This is what you and I want to achieve. So must not too vague. Dia faham apa yang kita nak. Kalau dia tak ada insight, susah juga. Kalau schizophrenia dia tak ada insight, kalau you target, beritahu dia nak target ini, dia pun blur je. Dia pun tak tahu. So, it's going to be tough. And then, it must be measurable, the progress. So, this is very important. When you set the goals, it must be measured, the progress. For example, patient ada masalah concentration. Concentration dalam, for example, melakukan activity, doing activities. For example, he's a restless type of patient, unable to sit down. So you want to do activity in group to improve dia punya concentration. Tapi kena able to measure lah. Berapa minit, mula kita tengok target dia 5 minit. Able to sit down, concentrate, do the activities together with the punya mates, with the group. Then after that, set another 10 minutes. Mula 5 minutes, then 10 minutes, then 50 minutes. So when for example, your goal is for short-term goal, to improve dia punya concentration. So how to measure dia punya concentration? By time. So easy to be measured, kan, dia punya progress. For example, last time patient too restless, unable to sit down, doing activities. Right now he able to stay there, concentrate doing the activity for 45 minutes. This is measurable. So when you set your goal, it must be measured. So how you set your goal? It must be levels. There is a level of goals. It can be short-term goals, intermediate goals if necessary, and also long-term goals. For example, your long-term goal to improve dia punya socialization. To improve dia punya socialization because this patient or this client have problem of withdrawal, katakan. Dia seorang yang suka menyendiri, isolate herself or himself. So this is the long term. You want patient able to socialize, able to participate in activity. So what should be the short term goals? Anyone? Hazika? Hello, Hazika.
Yes, saya.
Short term goals apa dia? The long term goal you want to Okay, Azika?
Short term goal. Ya.
Cuba je.
Short term goal tu. Yang saya nak cakap. Short term goal tu biasanya contoh kalau untuk dia punya rutin harian.
Okay. Rutin harian kan? You want
nak bagi
improve the long term
situasi ke?
You want to return the housewife to house kan? Ini dia punya you want to return back dia punya role sebagai housewife di rumah kan? Betul tak? This is your long term goal. Short term goals juga. Katakan dia suffer depression kan? Dia ada masalah withdrawal, isolation, tak nak buat ADL, tak mau play a role sebagai housewife. So your target long term you want to return her back as a housewife at home. Kan? So apa you punya short term goal? Short term goal you break lah. Pertama, for example, aktiviti memasak, kan? Sebagai si rumah, they have to do domestic work, kan? Domestic work, buat air, buat sarapan, lagi apa? Menyapu, membasuh baju, kan? Dia pun this is the short term. Your long term is to return her to dia punya role sebagai housewife di rumah. Short term goal, aktiviti memasak, dia dapat concentrate memasak, menyediakan makanan. This is a short term you break lah. So at the end, long term goal you untuk dia kembali sebagai housewife, seorang suri rumah di rumah dia. Intermediate goals apa dia? Contoh your intermediate goals, this is link with the environment, kan? Link with the environment. So apa dia? We should communicate dengan dia punya husband. Your intermediate goal to make the husband understand the condition of the patient and to manage her at home. Kan? This is the intermediate goals. Kalau husband tak faham condition wife dia, kadang-kadang sikap orang Melayu ni, dia lebih, kalau sakit, dia cakap tak payah buat kerja. Betul tak? Betul tak, Firdaus? Katakan dia sakit, tak payah buat kerja. Tapi it's not right. Contoh kalau sakit, buat kerja mengikut keupayaan dia. Kadang-kadang husband ni, bila isteri sakit, dia langsung tak nak bagi isteri dia buat kerja. It's wrong. So, wife dia dependent on him. So, you kena advise dia punya husband when return back to work or return back to home. This the thing you should support your wife. Pertama, kalau dia boleh buat kerja 2-3 kerja at this moment, you bantu satu saja, janganlah buat semua kerja. Contoh isteri ni perlu memasak. So at the beginning, husband dia kena bantulah, potongkan bawang. So encourage dia untuk melakukan tugas tersebut. Then after that, tambah lagi atas kepada wife dia sampai wife dia boleh independent dalam melakukan tugas sebagai housewife. Jangan jadi culture kita kalau Malaysia ni, kalau sakit jangan buat, kita bantu semua. No, it's not right. So your intermediate goal is to advise the husband or dia punya anak dia, to consult them. This is the thing that you need to do with your goals. So when you design your goals, it must be short-term goals, intermediate goals, or long-term goals. Okay. So one very important thing when you involved with the medical ni, is to document whatever you did to you design your intervention ke, you involve with the patient, you have to have a document. They call it SOAP. Bukan sabun SOAP. So this is very important because what? Because other members in medical or in health in hospital, they know what we do, and then for example the therapist want to continue your the intervention ke, you punya program, they understand because you already documented whatever you have done. So they call it SOAP. SOAP. So what is it? SOAP. Anyone? When talk about SOAP is a subjective thing. Subjective is mean input from the patient. Input from the patient, input from their medical history, and then from the punya husband. So it is very subjective. So patient view of the problem and their progress in goal attainment. So this is called subjective. So as. So for example, like patient come to you, he said he unable to sleep well. This is the subjective information. I mean information from the patient. For example, you are unable to sleep, they wake up at middle of the night, the hearing voice, patient complain, dia dengar suara. This is the thing. Dia tak boleh concentrate, kan? Dia cepat penat. Bi, tolong Bi. Patient cepat penat. For example, dia rasa berdebar-debar. This is the information from the patient. They call it subjective information. Lagi apa lagi yang kita boleh dapat daripada patient? Firdaus? Jangan lagi Kali tengok semua dia pasang lepas tu dia tinggal. Firdaus, apa dia Firdaus? Any subjective information can get from the patient.
Appearance.
Appearance? Is it subjective? Ada information daripada patient. Dia subjective ni talking about patient information, patient complaint. Patient complaint from patient. Itu dipanggil subjektif. Lagi contoh boleh bagi Firdaus?
Dia cerita pasal experience dia.
Dia depressed, dia sedih, sad, kan? Okay, she cakap, I'm very sad today. I feel I feel want to kill myself. This is information from the patient. They call it subjective. Anyone? Juliana? Mana Juliana? Lagi apa Juliana? Sarah? Okey. Kalau tak ada nanti beritahu saya kalau dapat lagi. Subjective. Sami information from the patient. So another, when you write the note, patient complain of, patient voice out dia punya opinion, patient apa. So more on for information from the patient. Then you have to write this objective. Objective section to document your objective observation. This is your objective. This is observation from you. Yang kita cakap tadi, you observe patient tu untidy, kan? Tak kemas, nampak apa tak cukup tidur, patient restless. Patient is restless, unable to sit down more than 5 minutes. Patient agitated. Agitated ni senang marah. Was the consumer or patient appropriate hyper-vigilant, hostile, dia patient argue, hypoactive, distracted, hyperactive, suspicious or argumentative. Dia seorang yang argumentative, yang cakap sikit nanti dia. So you observe. This is your therapist observation. You observe patient ada hallucination. Dia ada macam dengar suara, visual, dia nampak tengok ada nampak benda, kan. This is your observation. Was the consumer delusion, paranoid or persecutory, was suicidal or homicidal ideation present? For example, bila you observe patient ni, dia cakap nak bunuh diri, this is your observation. Tapi ada saja patient punya complain, saya rasa nak bunuh diri, itu patient punya complain, tapi you punya observation memang dia ada idea, suicidal idea. See, this is more your observation, therapist observation. Then from that you buat assessment. You buat penilaian from subjective punya feedback dengan observation punya from you. So you doing assessment. This is the view of patient affect, mental status and social functioning. So from the subjective, you're able to say social functioning of the patient is lacking, very weak. Social, they are unable to function at the interact with the individual or so. While they do activity also, you can do observation. Not necessary while you interview. While they doing activity or you do intervention, you're able to do observation and then make assessment. For example, was the consumer blunted, labile, sad, flat, angry, suspicious, euphoric, ashamed, depressed? So assessment is that you want to is like analyze your data you got from your subjective and also you punya objective observation or assessment. And then this the assessment is you analyze that. Then you come to conclusion. This P what? P is that your plan for the patient for the next treatment. Do you and the treatment team continue with the current treatment plan, or do you need a chance to update the treatment plan in light of a documented problem or event? Has it been 90 to 120 days since the last treatment plan update, and is it time to update the treatment plan? For example, you doing activity, for example, you do art therapy. You do art therapy, so patients have, you want to let them express dia punya emotion through art. So you did your observe and then you have analyzed your punya observation and subjective information. Then after that, you want to see, okay, the plan, next plan for for you punya intervention, you can document here. For example, you want to do art therapy in next session, so you can plan here. After you analyze your data, your data from observation and also from your subjective information from the patient. So anyone, any question from this so?
Doktor,
Okay.
ni anxiety dia terkeluar.
Oh, anxiety.
Doktor kena set balik.
Okay. Siapa yang tanya ni? Siapa yang cakap ni?
Alina.
Alina ada soalan tentang SOP ni? SOAP?
Tak ada. Tak ada.
Tak ada. Boleh bagi senario. Apa yang you tengok pesakit ni, katakan pesakit ni pesakit skizofrenia, dia seorang housewife. So you buat intervention, you design intervention buat domestic activity, aktiviti memasak. So you buat SOP, SOAP ketika memasak kan. So you want to document. Dari segi subjektif apa you akan tulis? Okay, you penyakit dia skizofrenia, you tengah train dia memasak, okay, you nak buat documentation, you want to write your SOAP. Subjective is that you from your patient lah. Kira you tanya macam mana aktiviti memasak ni, dia kata seronok, encik, saya seronok masak, dah lama tak masak. Okay. This is subjective, dia apa? Dia enjoy kan? Dia seronok. This information from the patient in term of subjective, dia input from the patient, they enjoy doing that domestic activity. Because dia dah lama tak buat, dia enjoy. This is subjective. Objective, apa yang kita write in term of objective? Anyone? Objective is that patient able to concentrate, kan? Patient able to complete the task, for example. Patient able to follow instruction. Patient able to creatively engage in cooking. Kan? Dia, for example, patient unable to follow the instruction, unable to creatively thinking in perform the cooking. This is your observation while patient doing the activity. And then A, assessment. Patient unable to independently complete the task as a housewife. Patient able to completely complete the task as a housewife, cooking, task of cooking. This is the assessment. So plan, patient next session will continue cooking, which is yang complicated cooking, for example. This beginning you buat cooking, buat sandwich. The next session, your plan of intervention is to do a complex task of cooking. Patient in future we'll do 3 hours engaged in domestic activity. This is your plan. This is called SOAP. Any question about SOP? Ada tak soalan? Faham tak? Faham tak?
Faham.
Faham, sir.
Yang post diploma mungkin dia dah belajar. Dia tahu kan apa nak menulis ni. Bila you buat clinical training nanti, terapis akan jump to the gun. Dia akan tembak you kalau tak kerti buat SOP. Dia tanya siapa, kenapa you tak boleh buat SOP, kenapa you tak dokumentkan? Kenapa? Oh ni apa benda ni? Oh ni kan. Jadi faham betul-betul when you do documentation SOP, because it's very important. When doctor want to discharge patient, dia akan tengok kita punya report kita ni, SOP kita. Kalau SOP kita tak seperti expectation diorang, in terms of dia punya expectation, then there's a problem. So I will highlight you a video. This is quite good in terms of SOP. Dia tunjukkan ya. Okay.
Welcome back.
Okay, sekejap. Saya stop share. Saya share video tentang SOP ni. Mungkin daripada sini you faham sikit. Nampak tak? Nampak tak?
Hello, welcome back. Today we're going to talk about SOAP notes. This is just the basic introduction to SOAP notes for those interested in or about to work in healthcare settings. The SOAP note is really used for documentation and communication. We document an interaction with the patient so that we have a record of what happened. That record then becomes part of their permanent medical records. We also document to communicate with our future selves and other healthcare team members that might need to know what's going on with the patient. SOAP notes are used across many disciplines within the health services. The information and length changes depending on the situation, but the basic structure remains the same. Today we're going to talk about the basic SOAP note structure and what a medical SOAP note would look like. There are 4 main parts to the SOAP note, and each part has a couple key subparts. Luckily, the name SOAP is an acronym and reminds you what those parts are. S stands for subjective, O for objective, A is assessment or what you think is going on with the patient, and P is the plan of action. The subjective section of your SOAP note should contain information gathered by talking to the patient, the family members, and the medical record review. Depending upon the nature of the encounter, it may include any or all of the following sections I've listed here. In a comprehensive or really expanded SOAP note, most often called a history and physical, you will review and document all of these sections. For more focused notes, like post-surgical progress notes or sick visits, you'll include only those sections that are important to the encounter. Remember, the O stands for objective. This is where you record your physical findings. This section should not contain anything the patient has told you. Note only your objective observations. Also, you may use information such as age and laboratory and diagnostic test results, but remember, it's just the facts. This section should contain notes about the patient's general appearance, their vital signs, and findings from the systems examination, like eyes, ears, nose, and throat, cardiac, and respiratory. The amount that you review and document really depends on the reason you're seeing the patient. Moving on, the assessment portion of the SOAP note is really based on the information you gathered in the subjective and objective sections. So it combines all the information you have so far and allows you to be able to decide what you think is going on with the patient. Depending on who's writing the note, the information in this section could be left as a general statement of what might be going on, or it could include more detailed information like the differential diagnosis and a list of billable medical diagnoses that you're seeing the patient for today. Finally, the plan is where the writer gets to decide what to do. This can include ordering or requesting consultations. If it's a medical clinician writing the note, then it may include prescriptions, treatments, and diagnostics like chest x-rays. It could also include patient education and anticipatory guidance. And then directions on when the patient should follow up are also really important.
Okay, so now you know the basics of the soap note. So let's go through an example and put this all together. Today we're going to see Mr. Fred Kealoha. He's a 62-year-old male who brings himself to the clinic complaining of sore throat. So let's walk through and actually write the soap note. The first part is a summary of what the patient tells you. When you document, you want to be concise and only summarize the important information, like the timing and severity of the symptoms and any other symptoms that are or aren't present. So I'm going to document that Mr. Kealoha is in today with a sore throat. That's going to be the chief complaint. The history of present illness, or the story of the chief complaint, is going to start with, he is a 62-year-old male with a history of hypertension, and he presents today with 6 out of 10 constant pain, worse at night, started 2 days prior to the visit. He has associated symptoms of fever, Tmax of 102. He denies headache, rhinitis, congestion, sinus or facial pain, nausea, emesis, cough, or shortness of breath. I know from reviewing his chart and confirming with him that he has already had his flu shot for the year, and he is still on lisinopril 10 milligrams for hypertension. He has allergies to sulfa drugs. He doesn't smoke, only drinks socially, and denies illicit drug use. Do you notice that I didn't put anything in about a social or family history because that's not really pertinent to this case? Let's go on to document the examination. The vital signs include a heart rate of 77, respiratory rate of 16, blood pressure of 158/92, and temperature of 100.3 Fahrenheit. For the general survey, I commented that Mr. Kealoha was an elderly male, alert, and in no apparent distress. His eyes, ears, and nose examination were all normal. His throat, however, wasn't. The back of his throat, called the posterior oropharynx, was red and inflamed. His tonsils were hypertrophied and had a moderate amount of white exudate, which is the medical way of saying he had a bunch of white junk on big tonsils. When I examined the lymph nodes in his neck, I noticed tender anterior cervical nodes on both sides. His heart and lung examination were normal. Based on all that information, I can make my assessment or my diagnosis. Starting with the global assessment, I summarized that the patient is a 62-year-old male with a history of hypertension who's in today with sore throat. Clinical picture suggests Streptococcus pharyngitis due to 4 out of 5 points on the modified center criteria. Differential diagnosis includes viral pharyngitis or retropharyngeal abscess. I'm going to diagnose him with Streptococcus pharyngitis and also uncontrolled hypertension. Next, you get to develop the plan. For his throat infection, I'm going to prescribe penicillin VK 500 milligrams 3 times a day for 5 days. I'm going to have him continue supportive care with salt water gargling, Tylenol, and ibuprofen for pain. There aren't any labs or consultations needed. I'm going to have him follow up in 3 days if no improvement, sooner if the symptoms worsen. For his hypertension, I'm going to increase his lisinopril from 10 milligrams up to 20 milligrams because he's not yet to goal. So that's the basic structure of the SOAP note. Subjective, or what the patient tells you. Objective, what you see. Assessment, what you think is going on based on the subjective and objective information. And the plan, what you're going to do about it all. I go into this in more detail for the nurse practitioner students. If you're interested in learning more, you can check out that lecture later.
Okey semua? Faham? Tapi ini lebih kepada fizikal kan? Daripada medical punya apa ni?
Doktor.
Doktor. So I will share you apa ni yang OT punya sekejap lebih kepada mental health punya Okey sekejap Okey. Ini lebih kepada apa mental health
I'm Jane Lesturgeon, and I create forms, tools, and tips that make mental health counselor work easier. In this brief presentation on SOAP note format, together we'll discuss the difference between subjective and objective data. We'll show concrete examples of subjective and objective data and help you gain confidence using SOAP format. As we get started, we all know paperwork can be a drag. Being better informed, though, about clinical note writing like SOAP format and having a quality form will really make your job much easier. SOAP is a popular format that many mental health therapists use to document important details from their client sessions. The subjective data is what the client states, reports, complains of, describes, etc. In other words, the subjective data is the client's viewpoint. Some examples of subjective data would be client stated feeling less depressed, or client reports feeling nauseous after taking medication. Client complained of being unmotivated to look for a job. Client described an intense argument with spouse after they had been drinking alcohol. Or client described feeling anxious and scared this morning while driving to therapy. So the takeaway tip for subjective data has to do with what the client shares, reports, describes, or otherwise expresses. It's not always easy to determine what is subjective and what is objective, but one way to look at it is the objective data is the therapist's observable and measurable and factual contribution, whereas the subjective data is from the client's viewpoint. Some examples of objective data might be focusing on mental health and mood status, the client's motivation level, their behavior, what you can see and observe and measure, physical health, emotions and affect, their level of functioning, and any personality issues. In other words, many of the same criteria used in your DSM-5 diagnosis. In writing, in the objective data section, the clinician might include things like the client was motivated to accomplish goals as evidenced by completion of homework assignment, or client wrung hands throughout the session. A client was experiencing a headache during the session, or client's emotions were labile. He swung from inappropriate laughing to crying. So the takeaway tip here is remember that objective data is mainly factual. It's normally measurable and observable. Now the A in SOAP stands for assessment, and this is where the therapist brings it all together and expresses his thoughts about what's going on with the client based on the S, subjective data, and the O, the objective data. Some therapists may also use this space to update the DSM diagnosis, to rule out or to rule in a diagnosis. But in any case, if there is a formal diagnosis, the assessment should tie into that. In the general sense, if one is using a formal DSM diagnosis, there must be enough evidence in the client assessment sections of your chart to support the diagnosis. Also, in focusing on the assessment portion of the clinical note will help you to keep track of and record any mental health criteria changes. So when writing the assessment, it's a good time to ask yourself if the client still meets the diagnostic criteria. Ask yourself, does the data support this diagnosis, or perhaps there would be a more appropriate diagnosis? The assessment should focus on those criteria that contribute to understanding the problem better and or reaching an appropriate and accurate diagnosis. For example, the clinician might write under assessment, client continues to experience depression and OS, client has occupational and family stressors, client expressing inappropriate anger, client exceptionally fearful of being abandoned, client test results showed hypothyroidism. So the takeaway tip for assessment is where you make sense of and analyze or assimilate the subjective and the objective data. Now the P in SOAP stands for plan, and the plan is essentially the action steps or the clinical interventions. It's presumable that the plan and clinical interventions drive treatment forward and encourage the client to meet their goals and objectives. So under the plan section of the SOAP, the therapist might want to focus on things like things both the client and the counselor are committed to doing. For example, the client rescheduled for the following week. plus any interventions such as the client committed to attending the domestic violence support group, or the client has attended 3 domestic violence support groups, or the therapist will continue EMDR and bibliotherapy. The next session, therapists will use guided meditation and assist client in learning relaxation skills. Other interventions such as nutritional, medical, or physical fitness interventions and the like that contribute to the client's therapeutic goals and objectives should be noted. So the takeaway tip under plan is essentially, the plan is a record of the action you and your client are committed to taking. So in summary, remember, review your SOAP note writing tips on a regular basis. And for more tools and forms to make your job easier, go to soapnoteexample.com or intakeforms.net or click the links in the description below this video. And for more Counseling Forms tips, subscribe to my Counseling Forms YouTube channel.
Okay, you dah tengok apa ni penjelasan YouTube tu. So anyone can comment about this SOP, especially who have been posted already. In the area of...
Hi, this is Dr. Diane Gayhart, and welcome to my lecture on progress notes that goes with my textbook, Mastering Competencies in Family Therapy, the 2nd edition. In this lecture, I'm going to talk about how to write progress notes, and you will find that these are one of the most common forms of documentation. And as you work in the field...
Okay. Anyone? Siapa yang pernah pergi posting apa ni psychiatry ni, ada isu tak writing SOP? Nabila?
Yes, sir.
Dia pernah pergi posting kan?
Dah.
So, ada tak documentation yang you buat SOP yang you dapat teguran daripada terapis?
Daripada yang intern saya pergi tu, SOP dia lain daripada yang belajar ni.
Ya, dia pakai apa? Sophia?
Dia, macam mana?
Dia pakai apa, Nabila?
Dia guna SOP juga macam ni, tapi dia punya content tu agak beza sikit lah daripada seajar.
Ya, macam mana content?
Kalau untuk yang bahagian objektif tu, mostly terapis dia letak assessment dalam tu, dan untuk yang bahagian assessment ni sebagai analisis. Analisis ni terapis akan tulis dia punya problem lah, patient punya problem.
Analisis lebih kepada dia punya finding lah kan?
Apa yang patient tu punya masalah lah.
Lebih kurang sama juga Nabila. Macam doktor kan? Doktor punya observation ni, dia punya objective observation, contoh macam dia check temperature kan? Macam kita, kadang-kadang kita guna standardized assessment kan? Jadi bila part assessment dia punya findings lah, betul tak?
Betul-betul.
Jadi macam doktor, kalau assessment ni lebih kepada dia punya diagnostic dia lah. Ataupun dia nak rule out diagnostic. Tapi macam OT, itu sebab observation it can O is more objective. It can be observation, it can be you using standardized assessment kan, contoh macam dekat psychiatric standardized assessment. Nabila, apa dia?
Assessment leisure checklist.
Leisure checklist. Apa lagi? You tak belajar ke? COT kan? Laser. Itu. One thing laser ni, itu sebab kalau dekat psychiatric ni, ramai yang guna laser kan? Client readiness. Kan dia ada pre-contemplation, contemplation and action kan? Betul tak?
Betul.
Tapi actually laser ni is for musculoskeletal disorder. Because laser ni is more on psychology of the patient. Dia ready or not. Dia dalam pre-contemplation ke dengan action. So is more patient have to client yang di assign ni lebih kepada musculoskeletal macam back injuries ke, fracture ke, kan? Sebab development of laser ni based on that. Population ni lebih kepada itu. Kalau baca dia punya item dia tu kan, dia lebih kepada physical punya issue lah. Psychological issue of the patient yang suffer physical injury. It's not for cater for psychiatric. Because patient have to have insight. Dia kena ada aware, dia ada insight, more on psychology. Yeah? Okay, good Nabila. So you all understand what is mean SOAP? Yang Nabila dia dah engage dengan clinical setting tapi kena ambil juga di subject because tak dapat credit exemption Yang lain yang matrik Firdaus ada apa-apa nak tanya? Saya tak ingat nama yang lain ni yang matrik ni. Siapa yang ada yang nak tanya soalan tentang SOP ni? Sebab bila sampai ke field, itu yang you kena buat documentation tu. Kena biasakan Okey. Kita sambung lagi. Mana? Okay, this is SOP. You have to familiar with this. I got a case study. I want to highlight to you. I want your opinion about the case. What are OT punya goals for this patient. So I will highlight to you all. Sekejap ya. Okay, can anyone read this case? Sarah Jamal, boleh baca? Sarah? Boleh baca Sarah? Ataupun Sarah dah hilang? Nurul?
Yes, Doktor.
Sarah, okey.
Sangkut je.
Sangkut, okey. Sarah baca ni, artikel ni. Boleh tak baca?
Boleh. A man aged 69 had been in hospital for several months, during which time he did not improve. He spoke to no one and would not employ himself in any way. He seemed to be deteriorating rapidly and to be passing into dementia. He was sent to the heart every day, but for more than a week, he showed not the slightest interest in anything he saw nor what was said to him. Later, he was induced to do a little sandpapering, which he did in an entirely mechanical way. After a time, he was given a fret saw to use, and this seemed to arouse some interest in him. As the days passed, it was apparent that his interest was growing more and more, not only in the work but also in his personal appearance, because one day he objected to the sawdust getting on his clothes. As time went on, he was given more difficult work to do, and in this he became truly interested and indeed enthusiastic. And when his discharge was being discussed, he was reluctant to leave the institution. He made a truly good recovery.
Thoroughly. Thoroughly, yeah. Bukan truly, thoroughly. Thoroughly.
Oh, thoroughly.
Thoroughly good recovery. Okay.
Good
So,
recovery.
okay, when you look at this case, problem with the issue of this case is that apa? He is the person who have no interest at all, kan? Don't want to communicate with anyone. Dia tak suka ada interaction to anyone. Dia tak ada interaction, tak ada communication, and dia deteriorate. Tak ada communication, tak ada interaction, isolate himself. Betul tak? So the goals of the intervention ni untuk ni apa? Kalau when we see baca sentence ni, he was sent to the heart. Heart ni OT lah, bukan tempat lain. So what the goals of OT in this in the person? Anyone? Non Syahira, macam nama anak saya ni. Non Syahira, what is the goal of OT for this case?
Yes, sir.
What is the goal of OT in this case?
Goal OT dekat kes ni nak bagi patient ni untuk ada interest.
Yes.
Activity tu.
Want to improve dia punya interest, kan? Interest. Well, it seems that he don't have any interest. He don't want to speak to anyone. Don't want to engage himself in any way. So, OT bagi apa kat sini? So, to increase the interest, OT buat activity sandpaper. Sandpapering, kita tahu tak sandpapering? Activity work. Sandpapering maksudnya kalau kita dah buat, kita tukang kayu, kita buat kursi katakan. Selepas kita dah buat kursi, sebelum cat kita sandpapering. Kita guna kertas pasir. Sandpaper ini kertas pasir. Kertas pasir kita bagi dia halus. Then selepas bagi itu dia dah engage dah, dia dah ada interest. After a time he was given a fret saw to use. Fret saw ni gergaji halus tu. So dia buat aktiviti menggergaji, guna gergaji halus. Then with this, when you engage themselves in this activity, dia ada interest, dapat tingkatkan dia punya interest, not only work but also dia punya personal appearance. This kita dapat observe, OT dapat observe when sawdust getting on his clothes. Maksudnya habuk tu dekat badan dia dah bising dah. Dia macam tak selesa kalau ada pasir dekat. Dulu tak kisah. Dia tak kisah, tak nak buat apa, doesn't bother. Sekarang ni dia nampak dah dia ada semangat dia untuk bekerja. So at the end, when his discharge was being discussed, he was reluctant to leave the institution. Why? Agaknya apa sir? Kenapa dia reluctant to leave the institution? Anyone?
Dia berminat.
Because dia dah ada interest kan? Dah ada interest. Even kalau dia balik ke rumah, dia tak buat benda tu. Mungkin dia duduk sendiri dan tak buat apa. So, sebagai OT, you punya long term goals apa?
Cari occupation.
Long term ke cari occupation?
Dia tak ada, dia macam yang melibatkan work yang dia berminat tu lah.
Yes, long term goals kita to settle within dia punya interest at dia punya place lah. Kan? Sebab apa dia tak nak tinggalkan institution tu? Sebab balik-balik rumah dia tak dapat buat apa yang dia minat. So, your long term goal, you need to work with the community, with dia punya relative, to engage him with this woodwork punya pekerjaan. This case one, very nice case. This is the OT punya approach. You should have short term goal lebih kepada nak improve dia punya interest tu. The ending one, settle them dekat dia punya rumah ataupun pekerjaan dia. Leisure lah, it become a leisure for him. Dia dah, umur dia dah 60 lebih kan, 69. Actually a retirement stage. Even retired person need to engage with activities. Kalau tak ada activities, for example lah, you tengok you punya keadaan sekeliling, you punya parents, you punya uncle ke, even though they retired from working, they still engage in activities. Betul tak? Kalau dia tak engage, sebulan lepas tu sakit. Percaya tak saya? Kalau tak ada aktiviti selepas pencen, dia akan decline. Dia punya memory decline, dia punya interest decline. Sebab dia tak engage with activity. That's why activity is very important. Siapa lagi tak masuk ni? Alia asyik keluar masuk Alia. Okey.
Doktor.
Okey.
Saya ada soalan.
Okey, siapa ni? Nama
Atira.
Atira. Okey, Atira. Ada soalan apa Atira?
Macam nak tahu patient punya interest ke kita bagi try and error je?
Macam mana nak tahu patient punya interest kan? Okay, good question. It can be by interview, by having a interest checklist yang siapa cakap tadi, Nabila cakap interest checklist. Some of your patient ni kalau dia dah macam case dementia ni kan, dia susah nak luahkan dia punya perasaan, dia punya minat dia. So you have to check dia punya history lah. Dia punya pre-morbid history, pre-morbid personality, dia punya history pekerjaan, dia punya wife dia, kadang you need to have information from dia punya spouse, wife dia, anak dia kan. Apa yang ayah awak minat ni. At the end, sometimes, as you said just now, try and error. Kalau kadang-kadang terapi kat hospital pun buat macam tu. But you have to go to the process lah. Interview, go to checklist, get information from the spouse, dia punya mates, dia punya friends. Kalau dia tak boleh bercakap kan, dia tak boleh express dia punya thought dan sebagainya. By the end, kalau dah tak ada lagi maklumat, give try and error. So, sometimes sampai stage tu lah. Good question. Siapa yang tanya? Sarah? Okay, Alia asyik keluar masuk dia, Alia. Okay, this second study. Boleh, siapa boleh baca second case study ni? Alicia, Maisara. Alicia, dia baca case study.
Ya,
Baca case study yang kedua ni. Nampak tak Alicia?
nampak.
Okay, baca Alicia.
A woman who had been in the depressed and somewhat agitated condition and who had maintained almost complete silence for about 2 years and who on account of delusions of unworthiness had refused her food and had been tube fed for several months, was put to the occupational therapy department. From that time, she began to converse and to take an interest in things outside herself. She improved steadily and rapidly and was discharged recovered.
See, this second case is about depression. Depression about 2 years of this complete silence, and had refused her food. Sampai tak nak makan kan, the food ada, and been fed for several months. So, been sent to OT department, and OT over there having short-term goals, and then slowly there is a progress. She began to converse and to take an interest in things outside herself. She improved steadily and rapidly and was discharged, recovered. So when being discharged also is a long term. Long term, what you should advise or what she should doing when she discharged. This is another long term that OT need to do. So any question regarding these two case study? I got another third case study. If we got time, we continue with another case study. Okay, we go to our point. So this is the activity. When we design our intervention, we have to analyze the activity. That is the thing that you have done in your lab, kan? You design lab too, so you have analyzed your activity. I like to show you one activity, a simple activity, making up tea. How they analyze the activity.
Hi, I'm
Hello? Yeah. Arif sibuk. Ada kelas saya tengah sibuk, ada kelas lah. Okay. Okay, I show you this activity. Sekejap Okay. Ni activity ni buat tea. How you analyze this activity? Okay. Okay semua. Itu activity analysis. Making a T also. You can analyze dia punya physical component, dia punya cognitive component, affective component, environmental characteristic. All that you can buat analysis. They call it activity analysis. This is what you doing right now. You punya lab, right? So I proceed with the activity adaptation. So in your activity, you have to grade. There is an element of gradually increase and or decreasing. And also there is a sequencing. Sequence is a different but related activity that will increase the demands of the patient as his performance improves or decrease, then as performance deteriorates. So if you want to do sequence, depend on the performance, whether the performance improve or deteriorates. So you have to design the sequence. This is the thing. Another thing, you have to consider the materials and equipment, the environment, the people that involved, the physical barriers, and then method of carrying activity. This is the thing that you have done in your lab. So when you implement your treatment, you have to be client-centered, and the therapist, while you're doing your intervention or your treatment, when you implement, you have to have a clinical reasoning. The procedural, the interactive, the condition reasoning. Then you, as a therapist, you need to reflect back. Whatever the intervention that you design, you need to reflect. And then the personality of the therapist, you have to change. If you have attitude of not assertive, passive, tak pandai communicate, you have to improve your personality. When you work with the psychiatric patient, you need to change your personality. Some of you, I'm sure, that there is issue of you unable to express your emotion, your feeling, all that. But if you able to do it again, time will change your personality. And then you must have experience and skill, and you must have therapeutic relationship, mean your relationship with the patient. Sometimes you have to be firm, sometimes you have to be friendly. This is the thing that you deal with the patient. And then you have to consider your activity. Some of the activity shouldn't be only simple, sometimes need to be a complex activity. The environment of your what you do, your activity, you need also to consider, especially when you do your activity in the ward. You have to consider. And then intrinsic motivation, and then Maslow hierarchy of needs. You need to understand human being in terms of hierarchy of needs. There is a thing that you need to consider, the needs of human being. For example, when they do the activity, they want to have earn money, earn support. They want to when they achieve things kan, bila they succeed, macam mana you nak bagi dia pujian dan sebagainya. So need to understand that. Okay, I think we can look into in this YouTube apa yang saya tunjukkan dalam slide ni. Okay, ada kat dalam YouTube tu. Nanti you bila balik nanti you buka YouTube tu. Okay, ada soalan tentang tajuk ni? Anyone? Atira?
Ya.
Ada soalan tentang tajuk ni?
Tak ada.
Tak ada. Alina?
Tak ada, Doktor.
Tak ada. Sarah? Anyone got question about this topic for today? Tak ada? Okay, kalau tak ada, saya akhirkan lecture saya kat sini. And then kita akan jumpa next week. Then kita ada lab, creative therapy. So, I hope you all can work together, fulfill the lab punya activity. Kalau tak ada soalan, okay, sampai sini je. Okay, stay home, stay safe. Enjoy your study. Okay. Okay, bye.
Okay.
Thank you, Doktor.
Thank you, Doktor.
Thank you, Doktor.
Thank you, Doktor.